Okay, good evening, everybody. We are very grateful to welcome back Michelle from UCF again for tonight's Caregiver Connection. As usual, we will say that the content of this presentation is proprietary and confidential information of the Florida Firefighters Safety and Health Collaborative. It is not intended to be distributed by any party without the written consent of the collaborative. Attendees should note that the educational component of this session is being recorded and will be published on the Florida Firefighters Safety and Health Collaborative's YouTube page. To maintain complete confidentiality, an announcement will be made before the recording begins, and only the presenter will be identified during the recording. Therefore, to ensure complete anonymity, all attendees are asked to mute their microphones until an announcement is made that the recording is complete. Presentations are intended for educational purposes only and do not replace independent professional judgment. The ideas expressed in this presentation are the professional opinion of the presenter and do not necessarily represent those of the collaborative or its constituents. Before acting on any of the information presented, attendees should consider the appropriateness of the information as it pertains to their individual situation and seek independent professional advice should any concerns arise. If you or anyone you know are in what is believed or perceived to be a situation that is or may become harmful, please reach out to the National Domestic Violence Hotline via phone at 1-800-799-SAFE, 1-800-799-7233, or through their website, thehotline.org, or dial 911 in the event of an emergency. With that, again, welcome, Michelle. I'll let you introduce yourself and kick off May's presentation. Stick around for some fun announcements and conversation after. Thanks again for joining us, Michelle. Your first presentation was amazing. I have no doubt that this evening is going to be just as awesome.
Well, I am going to start by saying hello, and I'm very grateful that you invited me back. I want to say that I in no way, shape, or form am a marriage expert, but what I do have is a lot of information. First, being a clinician with UCF Restores, which is a trauma clinic that addresses anxiety all the way through PTSD within the fire service. Subsequently, being out there in the community, doing outreach, teaching peer support training classes that we call React. And then, of course, being in the firehouses and talking to individuals. All those things have benefited me as a clinician in order to bring this information together to share with you all. And I think if there's anything that is most disruptive in the fire service is when relationships break down because of the stress and the demands that go on. And a lot of times, guilt and shame about relationships not working out can be another contributor to why people don't say anything about it or do anything about it. So my presentation today is going to address some of those factors that are not necessarily fun to talk about. What I'd like for to happen at the end of the presentation, though, is for individuals to bring to the forum things that have worked to their benefit. How have you overcome some things that I mention, or maybe that I don't mention, but have worked really well for you? And in the back of your mind, you're saying, man, if I could just share this with other families, that they would benefit from the information. So here we go. I will start with basics. Now, for here, the challenges of maintaining a marriage within the fire service, of course, this could really be any marriage. It doesn't have to be within the fire service. But taking a look at where do we start when we enter into a relationship, we're showing our best behavior. So what kinds of things do we do that show our best behavior? We open the doors, we call all the time or text all the time about the silly little things, just thinking about you, and anything that, brings that grin or smile to your face. And sometimes you might find yourself checking your phone or emails or whatever it is that you have, wondering, did they reach out? Are they thinking about me? And so I'm saying all this because I want you to just kind of remember what it is that makes you excited about the relationship to begin with. You give your 100% because you found somebody that you really think is worth all your efforts, and you want to make sure that they see the best of you so that they reciprocate. You're making sure it works, whatever it is. Is it the fact that you are out there doing fun things together? Is it that your friends and family members really think this person is great and they're accepting of that person? So that's how we start. So on the other side, what contributes to the end? Maybe our true self is showing the not so good parts of our true self, and that's not always the best version that we want others to see, but it's showing up now. Maybe because of the job, you gave everything you got to someone else's needs, and when you come home, you've got nothing left. Or sometimes you just say, hey, we agreed to be in this marriage, we took a vow, so why do we need anything more? Like, what more do you want from me? And so, stepping back, take a look at how this spectrum starts and what contributes to the end. And I think sometimes it's good to have these two things side by side, because why aren't you giving 100% anymore? Why is it somebody else getting your 100%? How come making sure it works is now too much of an overkill? Are you contributing or giving to your investment to make sure your investments are gaining? So just some things to think about as we move along on this page. So another thing here, everyday stress. The everyday things matter. In the fire service, long erratic hours. Hypervigilance, making sure we are prepared when those tones drop. The emotional overload, the exposure to families' negligence, people that live in squalor conditions, being a part of gruesome or fatal type incidents, some really drastic kinds of scenes that can create a lot of emotional numbness or emotional overload that might result in anger or even the isolation and the desire to not participate in life anymore. Lots of depression. Always being on. You don't want to be caught off guard. You don't want to miss that one little thing that could make the difference. And the never ending demands, always having to do more and always having to be on for that 24 hours. And then, of course, implied in here is little to no sleep. So what goes on at home? Long erratic hours, because sometimes that person is at home being the single parent. Hypervigilance, because they have to always check that they are at the appointment on time or the game on time, or that the certain things are being done on time, and making sure they didn't forget anything. The emotional overload of what's going to happen next. As soon as my firefighter walks out the door, something's going to break. as soon as they're gone for this whole time, someone's going to get sick. And if you don't have someone to stay at home with the other children while you deal with the sick child, now you're split in two, always being on. You have to have the cooking done, the laundry done, everything is on you when you're home for that shift, when your firefighter is at work. And never ending demands, always making sure that things are done, because when your firefighter comes home, they're not always ready to step into the household the way we would like them to be. So taking a look at both of these sides, again, the struggles are real on both sides. The struggles at the fire service, the struggles at home. And I have heard on many occasions where the firefighter comes home and the spouse is at the door with baby in hand saying, "Here, it's your turn." Or with the stack of bills, "Here, it's your turn." Because it's overload, because it's continual. And when the firefighters coming home, a lot of times the one thing that they want to do is just relax for a little while. They want to unwind and forget about what the last 24 hours are like. But again, these are mirror images of one another, whoever's at home and whoever is in the firehouse. So you can see how this is adding up to a perfect boil, a perfect storm. So this is my favorite slide out of the whole presentation. I'm going to take quite a bit of time to go through all this. I already mentioned hypervigilance, and I want to go back over what hypervigilance is, because it is one of those things where I think we underestimate the impact that hypervigilance has on our brain. It's a perceived threat, and it outweighs the perceived resources. That need of, I gotta get ahead of the danger. So when you're in hypervigilance mode, what is your body saying, or how is it responding? Increased heart rate, increased breathing rate, muscle tension, restricted thoughts, because if you're in that hypervigilance mode, you're only looking out for that perceived danger. And you are telling yourself that you have a limit of perceived resources to get you out of the danger. So fight or flight mode. And there's a decrease in emotional regulation, because can you be anything but on? Can you be anything but focused? No, because otherwise you can't see what's coming at you. So this results in unpredictable behavior, such as angry outbursts, such as intolerance, such as the desire to not rest when rest is necessary, such as maybe cutting corners on things the individual doesn't see as being important. And then even if you are at a firehouse that isn't necessarily high volume, sleep is going to be affected, because that hypervigilance is got you always on. So even at night, it's always one eye open, because whether you're at a busy station or not, you can't predict when someone's next emergency is. And there's nothing worse than going to sleep with that feeling of, what happens if I don't hear the tones on time and I'm the last one to get into the truck? You want to meet the expectation of a timed arrival when called out. So what does this do to you? No REM sleep, which REM sleep occurs about 20% of your night, and it happens during the end of the sleep cycle. So people that say, I'm always getting up around 2 or 3 in the morning, that's that part of the REM sleep where your brain has a different level of activity. It can inhibit one's ability to overcome emotional distress. So REM sleep helps you go through the day's stressors, lack of REM sleep, lack of ability to process all that stress. And when you're not able to process that, a lot of times the outcome or the byproduct of that is depression or anxiety or even a mixture. And so the person feels like they are off. Instead of on, now they're off. So to sustain this repeated exposure is going to start equaling exhaustion, which can present as anger because, again, lack of sleep, inability to tolerate, think, slow down, and process, loss of temper, or no ability to be patient. So think about when you are on a call, or think about when you are in the firehouse trying to get reports done. And then when you come back home or are approaching that door and you say to yourself, I just would like to sleep. I just would like to relax and unwind, but I know that my wife's going to need me to do this, or my husband's going to need me to do that. And so here we have this continual sleep deprivation. If that weren't enough, every time that you have an adrenaline rush or that dump, and that happens every single time the tones drop, you have this hormone boost. The hormones that you're getting an overdose of are adrenaline, cortisol, and norepinephrine. So adrenaline boosts your blood pressure and gives you that Superman energy. Now, I don't know how many of you have the Fitbit or the type of physio watch that can regulate how your body responds. But if you are in the firehouse, whether you feel the reaction to the tones dropping anymore or not, I would challenge you to take a look at at that physio watch or that setting on your Fitbit or whatever device you have, and take a look at what kinds of things start moving in the different direction. That heart rate going up, beats per minute, oxygen saturation, anything that you can collect or monitor, it's still happening because physiologically you can't control whether adrenaline's flowing through you or not. Cortisol is the stress hormone that increases sugar in the bloodstream to give the brain a boost and to be able to repair tissue if damage occurs. All right, so we have blood pressure going up, we have sugar levels going up, and then we have norepinephrine, which assists adrenaline to help divert blood from non-essential body areas to the organs just in case. So basically, that's like a booster to your adrenaline. You're supercharged and much more supercharged than the regular person. So while maybe the person at home understands and can recuperate from stress a little bit easier than you that are working in the fire service, just understand that when you have those adrenaline dumps, and how many calls do you go on? Even if the call is canceled, you still got the adrenaline dump, mind you. So it can take anywhere from 30 minutes up to 2 days to return to normal baseline hormonal levels. And that's whether you feel it or not. So ask yourself, what's it like? What happens when there's no time or a refusal to do self-care? And what I mean by that is, what are you doing to make sure that you're taking care of that recuperation time so that you can go back to baseline closer to that 30 minutes instead of those 2 days? How are you taking care of that hypervigilance? How are you allowing some of the education, knowledge, and understanding of what your job entails to help you mitigate some of these extreme situations? Now, suffice it to say, all these things are in place for a really good reason. But I want to add on just another layer. And another layer that I want to reference with all these body changes and impact on the brain. And I want to say that even though we're in 2021, we our bodies biologically have not evolved all that much since thousands of years ago. And what I mean by that is a lot of times when individuals in the fire service experience a lot of these adrenaline dumps over the course of years, several times a day, each shift, and they are storing all these hormones, it the body starts to think about what life used to be like when danger was every day all the time. Sometime the guy way back thousands of years ago would go out, try and get food for the family, and never know if they were coming back. So always hypervigilant, always wondering where the next danger was going to come from. When they do come back, they're hyper aroused because the body's saying, hey, if anything bad does happen to you, you better be sure that you pass your genes along or that you do something to make sure that your lineage keeps going. So, what I'm saying here is a lot of times we have situations where individuals have this hypersexuality or hyposexuality. So, either too much of or not enough of. So, how does that make conflict in a relationship? Well, by the obvious, too much of or not enough of can cause an imbalance between a couple. Because at the same time, the hypersexuality can also lead into other problematic scenarios such as pornography addiction, sexual addiction, maybe the desire to step out of the marriage because they have this desire, this need to follow through on their hypersexual drive. Yes, that can always be problematic, especially if they come home and there's such the disconnect that cannot be forged together in the relationship in in a way that's understanding to one another, because then of course the person at home that's been dealing with screaming kids, too many bills, too many obligations, that's the last thing that they might be able, to tolerate because of the stress. So understanding this, understanding where it's coming from on both sides of the street here, and saying to one another, this is a normal body reaction. This is something that's happening because of the job demands and everything else that I've mentioned up until this slide. So, what I'm saying up until this point is, what kind of conversations are you having? What kind of understanding do you have about the impact on the brain that stress and job demands in the fire service are having not only on you, but on the person you live with? And the person you live with, do they have the knowledge and understanding in order to be compassionate about how you're managing? So it's about perspective. Because at the firehouse, it's organized and structured. All things have a standard operating procedure. But at the house, routines are nice, but don't count on it. At the firehouse, control means everything's okay. But at the house, if I could control the weather, money, traffic, kids, school, house. At the firehouse, emotions mean that I will become intimate with what I encounter. At the house, I need to be emotional, see emotion, to know that everything's okay with us. At the firehouse, when I'm at work, I want to be home. when I'm home, I want to be at work. Because I've noticed too, what do y'all have on your phones? I think it's called Pulse Point, so that you know, even when you're home, what kind of calls are going on with the people on shift. That's disruptive. And a lot of times at home, I need him to be home when he's gone, and when he leaves, it can sometimes be a relief. So one of the things that UCF Restores has put out, and I really apologize if this slide is not very clear, is to also understand that the response to traumatic events can also contribute to relationship difficulties. So here's what family, spouses, and significant others should keep in mind. And I'm going to read it, not to bore you, but just because I realize it's not very easy to read. But that your loved one has been involved in an emotionally charged event, might be experiencing normal stress responses to the event, and it's normal for them to experience stress related to this occupation at any time during the career. No one in emergency services is immune to critical event stress, regardless of past experiences or years of service. So what should you know? There's many signs of stress related to events of the job. Your loved one has received information outlining these signs. Ask him to share it with you. We can talk about stress. Stress response may occur at the scene of an incident within hours, days, or even weeks after the occurrence. First responders may experience a variety of signs and symptoms of a stress response, or might not feel any signs at this time. And with such a wide range of dynamic, all of it's normal. Suffering from stress related to a critical incident is completely normal. Besides your loved one, other emergency personnel shared the event and are probably sharing the reaction. And so sometimes having no reaction is still a reaction. The symptoms will normally subside and disappear in time if you and your first responder don't dwell on them, which means don't dwell on the extreme portion of it. And when you talk about time, I think that a lot of situations can take up to a month to recover from. Encourage, but don't pressure your loved one to talk about the incident and the reaction to it. Talking can be helpful, but the primary job is to listen and reassure, remembering that if an event is upsetting to you and your loved one, your children might also observe how you're affected also, and they might need to talk about it. Such things as, why does my parent sleep in the afternoon? Why are they grumpy when they come home from work? Things such as that. The impact of a significant event can be influenced by other personal and family things that are going on at the same time. So maybe there's aging parents, maybe children are having difficulty with school, maybe there's neighborhood disruption, all these things. And that's not even to talk about financial stress or some of the other obvious stress that can impede a relationship. You might not be totally able to understand what your loved one is going through at this time, but offering love and support. Don't be afraid to ask what you can do that might be considered helpful, and not assume what's helpful. Accept the fact that despite all these disruptions, life's going to continue. Try to maintain or return to a normal routine as soon as possible. Relying on routine, relying on what you know is going to come next can really be helpful. Settling that mind, not allowing that hypervigilance to continue and always wonder what's going to come next. If the signs of stress that you or your loved ones are experiencing do not begin to subside within a few weeks or up to a month, or if they intensify, consider getting help. And I guess if I can say anything for Mental Health Awareness Month, that happiness is part of that mental health continuum. And if you're not as happy as you really want to be, then go in that direction. It doesn't always have to be something crucial before you get someone to help you get back on the right side of things. So, in addition, and again, I'm so sorry this is small. Listen. Sometimes that is all that is needed, is to just listen. It's not necessarily important to talk about the details of the call or of the day or of the situation, but recognizing the emotion that the person's experiencing. Maybe they are stuck. Maybe they are feeling overwhelmed. Maybe they are feeling inadequate. Those are feelings that sometimes are really hard to describe, how hard to relate to one another. But I think that if we started listening to what emotions we have back and forth within each other, I think sometimes it might be easier to be compassionate when our spouse is not behaving the way we wish they would. Obviously, don't encourage your loved one to quit work just because you're going through a difficult time and you can relate it back to how they're managing at their job. And this can be overcome. I like to find every opportunity, even if you're dealing with PTSD level symptoms, PTSD can be remitted. There is treatment out there that UCF Restores can provide, and subsequently other areas as well. We can take PTSD and knock it out. Now, what we can't knock out is the fact that you've been exposed to trauma over and over again, and there's stress that comes from that. But we can take away the impact that the disorder from being exposed to all that can have on you. And that's what's so helpful to know. Include the family in the healing process. The one thing that the person that's at home wants more than anything else is just to know that you're going to be okay and how they can guide you along. Because remember, way back in the beginning, what did you do? You gave 100% to make sure things were going to work. You gave it your all. And no matter how tired each one of you is or how stressed out each one of you is on both ends, coming back to the healing process, that basic understanding is what's really going to turn the corner. Watch for those small strains in your relationship. If you need someone to talk to through a difficult moment, I'm a true believer that therapy should not be forever. Treatment or therapy or counseling, whatever you want to call it, is there to get you through difficult times and back on your feet. And if you're meeting with somebody that's not giving you that ability to get back on your feet and not depend on the treatment process itself, then I would encourage you to consider more about what you can do to be an independent person in your relationship without depending on that third party. Now, I will say that sometimes having that third party there when you need to discuss something crucial can put you back into that baseline of being on your best behavior. Because typically when somebody's watching, that's exactly what we're doing. We're on our best behavior. Whereas when we're at home, sometimes our less honorable behavior comes to the surface. At the end of the day, take care of yourself, because the more you take care of yourself, the better you're going to be able to take care of your family members. And don't forget to enjoy the little things. So if you're dealing with a spouse that has had repeated exposure to trauma, make sure that you listen very carefully to where the disruption is occurring. Reassure your loved one that you are there through anything. Don't take anger or their inability to maintain good behavior personally. Now, I say that with very loose terms because sometimes that's almost impossible when we are emotionally connected to somebody we love. When they get angry and say really hurtful things, it hurts a million times more. But try and understand that somebody who's under stress has that automatic reaction, and it usually comes out in anger. If there's a way that you can talk about angry reactions ahead of time and know, I don't know, maybe it's a signal, maybe it's a code word, maybe it's just a routine that you establish to lessen the impact of angry outbursts, that could be a contributing factor towards a better outcomes, avoiding those situations. And then, of course, don't say things like, "Oh, you're lucky it wasn't worse," or any kind of those statements. That it does not help, because a lot of times people don't want to. I don't want you to feel sorry for me. I don't want you to tell me it could be worse. I don't want you to tell me how lucky I am, because what first responders encounter a lot of times have that moral injurious situation, and sometimes it's much deeper than just what they had to touch, see, smell, and be a part of. So again, I'm going to go back to the understanding of perspective. No matter what side of the door you stand on, how are you going to decide to communicate? What kind of expectations are you going to set for each person on either side of that door? How are you going to share? How are you going to establish your sense of being purposeful? And who are you? And what version of yourself do you really desire to be? Those are the questions that I think that can really start new conversations and a new way of looking at things to really turn the corner if your relationship needs that. Oops. At the end of the day, tomorrow doesn't need to be like it was today. It's all temporary. Family isn't always blood. The way it was isn't the way it should always be. And change really means that what wasn't working has a chance to be better. So over to the left, some words of encouragement that you can say to yourself and share with your spouse. I don't always know what you went through today, but I know I'm thankful you did it for our family. I can't always share what it was like, but I can tell you I'm happy that I can share the best part of me with you. And that's your goal. Despite all the ups and downs, that's your goal with one to another. And but in addition to UCF Restores, I want to say that one book that I found, it was titled Fully Involved, A Guide to Being in a Relationship with a Firefighter. And I thought that that author, Minda Oz, hit things, many points spot on. She's a wife of a first responder and a clinician, so she's got kudos for me. I have found on the IAFF website some very informative pieces of literature. I know that through the Second Alarm Project, there are many things in their app and on that of resources for spouses and families. And also the American Military University, EDGE, also has some good literature. There was an article in particular, 2 In, 2 Out, that related to relationships in the fire service. And I feel like I spoke a mile a minute, but that's it in a nutshell.
Help, I'm in a nutshell. Thank you so much for that wonderful informative conversation, and most especially for being back with us this evening. Before we start questions and stop the recording, again, I did want to mention that starting next week, the second Thursday of every month, we are beginning our family face team, our peer support group, much like this, but for families who have lived through and are facing cancer diagnoses in their households. I'm more than welcome to join, ask questions, and be a part of the conversation. You can sign up at the registration link there. Again, the second Thursday of every month, we will now start our family face team. With that, I will tell you that there were some really powerful things this evening. One of the big things that stood out to me, both as an individual and, and a firefighter, was, hey, you shouldn't be in therapy forever, right? And a big part of barriers to care is firefighters walking into that first experience and it stinks. And had I done that, I would have never found the therapist that got me through so much. And so always encourage people, right? At least 3 therapists. And there's no shame in switching them. And there's no shame in couples therapy either. Because I found, at least, and maybe Michelle, you can talk about it. The couples therapist that I went to with my ex-husband, I know it sounds weird saying that, right? My ex-husband and I went to couples therapy. It's like an oxymoron, but she actually led us to the place where we really needed to go that was healthiest for us. And she had some really heavy conversations with me specifically of, listen, nothing is going to change. It's time to make some decisions here. And so couples therapy can really put you on the right path. I don't know if you want to comment on that, because I know it sounds weird saying my ex-husband and I in couples therapy, and here we are. So I don't know if you can speak.
No, I think that sometimes, it's not about the couple, but maybe it's about co-parenting to your best version. Because again, the kids are a byproduct of the relationship, and what they want to see, even if their parents can't be together, is that at least their parents are showing kindness to one another, even if it's for their own benefit. But again, a whole nother layer of stress that can, rock people's world.
Yeah, absolutely. Thanks for that, Michelle. Did anyone else have questions or anything that they want to discuss? Remember, we're still recording, and we will turn the recording off if no one else has anything that they want to ask during the recording. Nope. Okay. So we are going to stop the recording now and continue the conversation in our private environment. Thank you again, Michelle, for your time, attention, and dedication, not only to the fire service, but to the collaborative and the Second Alarm Project. And we're very much looking forward to seeing all the neat things coming from Michelle in the upcoming months and her adventure. Grateful to be a part of it, and hopefully we'll see you back here soon. I'm going to go ahead and stop the recording.